from the doctor. I bugged him until finally in July, they sent me to another doctor. They sent me to an ear, nose, and throat doctor who did a very simple hearing test and realized that my hearing was different. My hearing loss was different on my right and my left side. And she said that when you have a differential in hearing loss, there's a very rare tumor that it could be, and we're just going to rule it out. So when I send you for an MRI, just rule this out. And this, it's pretty rare, you're not going to have it, but we'll rule it out. So on July 5th, I went in for my MRI. At 4 p.m., my MRI was scheduled for 4 p.m. So right before the MRI, they said to me, when you're done, go home. We'll call you in a few days with the results. Immediately after the MRI, so around 5 o'clock, they said, wait here, we're going to print your films and you're going to take them with you. So imagine that huge change in their attitude from before when they said, go home, we'll call you in a few days, to right after where they said, wait, we're going to give you everything to take with you. Now, it doesn't take a brain surgeon to know something's wrong, something's going on. The next morning, my ENT called me and wanted to see me right away. And I of course are very, worried and curious. What did they find? This is an MRI of my brain on that day, from July 5th, 2006. Can you guys see the abnormality? Just in case you can't, I do point it out for you. That big white mass looks like a golf ball is a tumor. So that tumor was, you can see it's pretty big. It was about 25 millimeters by 35 millimeters. So it was a pretty good mass in my brain, and it was pressing on my cerebellum. What is the cerebellum for? What are the main things that the cerebellum does?
Breathing.
Does some breathing at the brainstem. It also does a lot of balance and coordination. So think about my symptoms of dizziness and nausea and lack of, like I could not balance on, one foot. That's, my cerebellum was being compromised. So my cerebellum was compressed. Now what they told me about this tumor, other than it being, rare and don't worry about it, was that it's a benign tumor. It's called an acoustic neuroma, if anybody wants to look it up. Acoustic, meaning by your ear, neuroma, just the name of the tumor. An acoustic neuroma, and it's a benign tumor. They can take it out, they can remove it surgically, and I should have no lasting effects. They even said to me, if you have to have a brain tumor, that's the kind to have. So my answer to that, of course, is, well, why do I have to have a brain tumor? So that was the smartest thing to say to me. So things moved pretty quickly after that, because it was a pretty big tumor that was still growing. And more importantly, I was getting sicker. I was just getting more and more nauseous and dizzy. So what I thought is that, cool, I'll get this thing out, and then my life will go back to normal, and I can continue on the way I was. So things that they told me about this tumor and this operation was that it was going to be a 13-hour operation. Now that sounds scary, but honestly, I didn't care because I'd be sleeping. That's more for my dad to worry about because he had to be there. That it was an excellent prognosis, that I'd be in the hospital for 5 to 10 days. So, it sounded pretty, and there would be no lasting effects, that I wouldn't even need physical therapy afterwards. I was planning to be back at work. My surgery was on July 26th. As far as I was concerned, middle of August, when school starts, I'm there. I was planning to be there. Well, things didn't go as planned. My surgery was on July 26th. Instead of 5 to 10 days in the hospital, I spent about 246 days in the hospital. Various hospitals. I wasn't just at one. I was at rehab facilities and the hospital for those 20. So I did not come home until March of 2007. Sit. likes to take his time. He's kind of like a 2-year-old. But he's almost 6, so I don't expect that behavior from him. Come and sit. Good boy.